Hi everybody, this is Tony. This is a specific exercise for a patient with the initials DW, but if you somehow got onto this website or this video, this is for pre-total knee replacement. This is again for a specific patient. However, there is good stuff here. I do suggest that you do follow your physician's plan, because not everything in here is directed for all knee replacement patients. So first exercise for DW is wanting to walk with the walker ahead of time. So what you're going to do is practice walking with the walker without weight bearing through the affected leg. So it's going to look like this. You put the walker forward, both hands on the walker. You can put the walker forward, put pressure onto the arms, and proceed to do walking. Simple enough. Next exercise to be doing before surgery is for I have these steps. You're going to want to mimic a non-weight bearing status going up and down the steps. So you go to your steps, you go to where you have a railing. I'm going to use the walker because I don't have a railing in here. And cane, because I know DW has a cane. You're going to put the good leg up first. The cane go up. And then try and do non-weight bearing through the other leg. Alright, you're going to do this for all the different steps. You're also going to do it going down. So you have your railing, you put your cane down, try to do it non-weight bearing up and down steps. Again, this isn't to get your knee you're going to have surgery on stronger, it's to get your other muscles stronger so the day you go home it's not so difficult to do. And you're already conditioned for it. Let's move on to the other exercises. Long arc quads. This is just sitting down in a chair, preferably a chair in which your feet can dangle, and you're going to get full thigh support. Obviously mine doesn't do this because it's a weightlifting bench, but you want to, usually a bed is going to be nicer because the bed is usually higher, lets your feet dangle. And you're just basically going to straighten the knee out and bend it. You can use ankle weights for this exercise. Next, quadricep exercise in standing. This is you can see the attachment for the band that I have here. There's other bands out there. I'm pretty sure DW has a band similar to this. So I'm putting the anchor in the door, making a loop. This is going to go behind my knee, not right where there's the crook of the knee, but just slightly above where it actually bends. And I'm going to step back until there's tension on the band, enough that when I contract my quadricep muscle, it's going to be quite a big pull. And you're going to feel a lot of resistance, and you're going to repeat that. So this gets end range quadricep strength without too much pressure on the knee in terms of any type of squatting or anything like that. Another band exercise. I'm going to put the band down lower. I'm going to sit down, and I'm going to pull back. And again, this might be better if you use the calf strap. I believe the calf strap was included in your package for the bands. If not, you can set it up like that. Other bands, again, can be set up differently. I'm pretty sure that's the bands that DW has. Next, laying down exercises. We have a few of those. First one is going to be the short arc quads. This is going to be done not laying down on the ground, but laying down in bed, because it's very difficult, I know at this point, to get down on the ground. I don't have a bed in here, so I'm going to demonstrate it on the ground. But typically you don't want to be on the ground to do this. You're going to have your support, either a If it's bent up like this and you have all sorts of pillows underneath, that's even better, okay? But I don't have that here, so I'm just going to do it on this. So I'm just straightening out my knee from a bent position, up and down. And again, I can put ankle weights on for this. Oh, I'm getting ahead of myself. We also have just quadricep sets. So basically I'm laying here on the ground. I'm going to squeeze my quadricep muscle, push it into, as if I'm trying to push it into the ground. So there's no actual movement going in here. It's just I'm contracting my quadricep muscle nice and tight at the end range. This is going to be an exercise they're going to be teaching you probably day 1, day 2, if they haven't taught it to you already in your pre-op exercise class. Next, straight leg raises. So I'm going to contract my quadricep muscle, keep it real tight, lift it straight up and back down. Notice I keep my other knee bent in this position, so I'm supporting my pelvis and my back, so it's not too stressful on my low back when doing this. I believe that was it. I'm going to post a video. If you have questions, please give me a call. If you're stumbled upon the video, put your questions in the comments section. I'll try to answer if I can. Thank you and have a good day.